Visual Cath Report, VCR, represents a radical new solution set in the realm of cath lab reporting. The clinician simply creates a model of the patient's anatomy through VCR's dynamic graphical interface, and VCR creates a full natural language report from this model in a uniform reporting style which exceeds ACC/AHA nomenclature in both its completion and level of detail. VCR reduces facility overhead by eliminating the need for transcription, allows for immediate review of the diagnostic report, and facilitates rapid turnaround of the report to the referring physicians. VCR is designed to truly represent a patient's coronary anatomy on an individualized basis. The clinician can easily choose from right, left, or codominance, represent anomalous coronary arteries, such as the RCA arising from the non-coronary cusp, and display varying degrees of tortuosity present in a vessel. The user may populate the coronary tree with branches and sub-branches necessary to represent the patient's anatomy, and VCR automatically identifies and labels each by name according to its position. A branch added between the circumflex and LAD is identified as the ramus intermedius, and VCR recognizes it as trifurcated. Branches can be stretched, curved, and relocated as desired to best recreate a specific patient's individualized anatomy. Aberrations such as stenosis can be selected from the menu. The user can clinically represent the degree of stenosis before or after adding it to the tree. VCR's aberrations are dynamic, and the user can drag and stretch them to best represent their lengths. VCR also recognizes and reports on whether an aberration exists within the proximal, mid, or distal segment of a branch, or if it overlaps segments. When 100% stenosis is added to a branch, that branch and all dependent branches will appear ghosted to represent the blockage of blood flow. Irregularities, aneurysms, and ectasia can be added and graded as mild, moderate, or severe. Arterial and venous grafts may be chosen from the menu, and VCR will identify them by their origin and destination, such as recognizing a Lima graft which connects to the mid-segment of the LAD. VCR also recognizes and reports when a graft bifurcates, and graphically represents revascularization of branches. Sequential grafts may also be represented. VCR can represent bare metal stents as well as different brands of drug-eluting stents, and can describe their width, length, and date implanted. If a user overlaps a stent and a stenosis within a branch, VCR recognizes and reports this as in-stent restenosis. The user may right-click any object on stage to change any aspect of that object, such as redefining a stenosis as concentric. VCR can also represent collaterals, allow the user to define severity of the collateral, and graphically represent revascularization of an occluded branch. The user may also right-click on any object to insert a diagnostic comment which will appear in the final report, or drag an annotation box to insert a note which will appear on the saved graphic but not in the natural language report. VCR also includes a secondary menu of aberrations, including thrombus, ulcerated plaque, calcification, spasm, and myocardial bridging. These are draggable and stretchable as well, and may also be modified as to severity. VCR will automatically generate a complete natural language cath report derived from the coronary tree graphic. VCR can parse out particular information to individualized databases per vendor specifics. Included in the report is a summary for quick review of the major aspects of the patient's anatomy. The VCR control includes an extensive API, which permits programmatic manipulation of every feature.